So somebody is missing one tooth in the front or a broken tooth in the front. What are the options?
Oh, you know something? That's one of my favorite procedures to do in the practice. You know, it's because it's the front tooth. So this is what we do. At that appointment, I tell the patient, we can do this today. This is an emergency. It's a front tooth. So we take a computer tomography, and then with this, I'm going to be able to trim implant perfectly that implant, just nail it, you know, in a very accurate way. With my CEREC technology, with the same crowns in the day, I actually can put a crown on that implant the same day, and making sure that it looks exactly like the other teeth.
So the dental implant in the front. What about pain, by the way?
Oh, today, one of the procedures that I'm very happy to do today is dental implants. And why? Because the pain the patient experiences next day, I always say, is going to be from 0 to 1 out of 10. It doesn't hurt. Because, and when patients come back, I ask them, so how painful was it? Dr. Vasquez, I did not believe you. But yes, it didn't hurt at all. Just a tiny nail will take care of it.
And that can last for, does it last longer than like a partial or a bridge?
Oh, a partial, they're just annoying. You know, those little removable things, people are going to grab them, they're going to throw them away. In a bridge, you know, why cut two healthy teeth and cap them when we have a beautiful bone and we can put an implant? And let me tell you this, that implant, and this is what I tell my patients, you're going to die, you're going to turn into ashes, and that baby is going to be there.
Okay. So it should last. Now, how old can you be to get an implant?
There's no age to get an implant. If you're missing a space and we need to place a tooth in there, you can get the implant. I always say as early as 18 years old to 70, 80 years old. Nobody wants to be walking with a front tooth. Would you like to be without a tooth, Randy?
No.
Yourself?
No.
No. So
And missing 3 and 4 teeth in the back, dental implants?
it works exactly the same. Now, again, with the technology that we have today, with the tomography, you know, it's safe because today implant dentistry, it has to be safe. Why? Because I'm going to be able to see everything beforehand. I'm going to know the quality of bone do you have. Is any anatomical structure that is going to be in my way if I have to do extra. So planning, I call it backstage planning. I can plan everything before. So the day that I'm going to do the front stage, the day of the surgery, everything goes, it's just flawless. It's a beautiful appointment. It only takes about 7 minutes to place an implant. Perfect. And obviously, you know, the pain the patient's going to have is going to be minimal. Why? Because in most of these cases, I don't have to flap. I don't need to do an incision. So,
Interesting.
no, we just go, we create the little tiny hole where the implant's going to go. So the tissue is not even, we don't bother the tissue. So that's why patients normally don't have pain.